Aubree Nelson, 70% of Americans are cited to have anti-black bias. The study was done by Samil Haram Balik Ahan, a doctor of psychiatric and mental health nursing, stated in Journal of Health Services, published in 2019. Everyone in this room has sought some form of medical treatment in their lives, whether that was for a broken leg or just something like the flu. Everyone should be able to get medical help when they need it. The American Medical Association should prosecute medical professionals for denying care to patients due to preconceived biases. Discrimination in the medical field is a very big issue. The reason that this is an issue is because it can cause certain discriminated against individuals, including homosexual people, transgender people, or different ethnic groups, to not seek treatment even though they require it. This can mean that they will avoid going to an ER visit even though they might get into a car accident or something more extreme. Even in places like Arkansas, for example, no medical professionals there have to provide care to someone if they do not want to, even if that would save the patient's life. Some stigmas include thinking that black people can't afford care or that they can't feel pain is one of the cited problems that came up. And this could also mean that like transgender people's bodies are inherently different in that they require different care, which is true. However, they can still take prescription medication and like things like that. LGBT centers are something that obviously exists. However, they can still have racially motivated biases. This means that even though they can maybe care for someone who is transgender, who is white, better than a traditional like Mayo Clinic hospital could, that means that someone who is black and transgender, for example, might not seek that assistance. Some of the solutions that exist include increased medical training for professionals, and that includes diversity training for transgender people. Transgender people's care is inherently not included in medical education. And this is important because they are people who have a different skill set. They require a different skill set. And this means that they need specialized care, but more doctors should be able to provide that care. Susanna D. Howard, Medical Director of General Internal Medicine, wrote in Journal of General Internal Medicine, published in 2019, that participants in a study commonly cited providers' assumptions about trans people of color as a pivotal factor in negative experiences. Some of these negative experiences included not believing them when they talked about their symptoms or what exactly was wrong with them, and they were just assuming that they were exaggerating, or that they were just trying to get a medication in order to sell it or to get high. Alexandra Marshall, Doctor of Health Behavior and Health Education, wrote in AIDS Care, published in 2017, said that 5 studies to show HIV stigma were conducted in the US, and all showed a anti-stigma among providers about HIV care. And while HIV care can be a bigger problem for like gay people, that doesn't mean that only gay people can have an HIV issue. Hinton Rossman, a doctorate in trans and sexuality teaching, advocacy, and research, along with Paul Salamanca and Catherine Macapego, who are both doctorates in medical social sciences and Institute for Sexual and Gender Minority Health and Well-Being, stated in Journal of Homosexuality, published in 2017, said that a qualitative study was done on a diverse sample of LGBTQ young adults and their experiences of disclosure and non-disclosure to medical providers. They said that they felt that they received a far higher level of care when they did not tell their providers that they were gay or that they were trans. A national standard should be created for medical professionals to have to treat people, because discrimination is something that you can hold to yourself, but as a medical professional, you should not allow that to affect your care for others. The American Medical Association was founded in order to stop discrimination and in order to allow women to have control over their bodies and that kind of thing. And in order for this to become a law, essentially, that you have to treat people, this would have to go through the House of Representatives and the Senate and everything like that. And in order for this to be aided by the American Medical Association, they would have to put in a ton of money, which the American Medical Association can do because they are one of the top 3 richest lobbying people in the United States. This law would have to be personalized depending on the individual case and the individual state or facility, because it is not fair to assume that anyone who is racist will no longer be a doctor. So that would mean that they would have to have a certain skill set in place where trans people would have to go to certain doctors, or if that doctor felt like they could not treat them, they could not just decide not to treat their issues. Emily J. Nune, a medical professional at LGBT Center Satellite Office at the Health Sciences Center of Louisville, published in Teaching and Learning Medicine, updated in 2019, said that supplemental education interventions for practicing physicians will improve the current conditions of transgender healthcare, as well as a comprehensive medical school curriculum specifically for transgender health. First, I talked about the problems that different discriminated against individuals face in their day-to-day lives, and second, I talked about how a solution of increased teachings and laws about what you can and cannot do as a medical provider would help. The American Medical Association should prosecute medical professionals for denying care to patients due to preconceived biases. When 70% of Americans have an anti-Black bias, this is a bigger problem than I think